Well, actually, the validation platform actually is a platform to test the electronic health record data standard and the sharing feasibility in Hong Kong. Actually, it's a project initiated by the eHealth Consortium. Actually, we try to go one step earlier than the official government territory-wide eHealth sharing. Our aim is to get as many as possible our private and also public healthcare providers and try to generate the electronic data in the same standardized format so that we can start learning how to share with it in the correct format before the real project of eHealth sharing goes on live in 3 years later. So actually, the essence of this project is for us to work together in a pilot stage so we can learn about the territory-wide data standard in healthcare and also try to practice beforehand to try to use sample data so that we can submit in a standardized, we call it the XML data file format, conforming to the HL7 CDA standards, so that we can, during this process, learn about the standards, learn about the possible workflow, and to demonstrate that it is really feasible, so that we can do it in the future. But more importantly, it gives us an arena so that different stakeholders show their willingness to participate. And during this process, we can exchange views, express our difficulties, find out all the obstacles and challenge so that we can give a report to the government to give them as a reference for the real big projects to establish. So I believe this is a very meaningful project, and very luckily we have more than 12 different health stakeholders from both the public and the private sector to participate. We almost comprise the majority of healthcare service providers in Hong Kong. So this is really a very, very good project.
Actually, as Dr. Wong mentioned, this platform is important. Just having the idea, having the standards, without trying it, we're just talking something like up in the air, like a castle in the air. Having this platform, we, the stakeholders, the private hospital, the private sector, and also the hospital authority, as one of the big stakeholders who come together and discuss what are the issues. Say, for example, we want to do some exchange. This is what I always call it this way. It is the concept of having the medical record that follows the patients. And the patients, with his or her consent, actually they can access whenever and wherever he or she wants. So this is the major objective, and this is a good starting point of having this validation platform project.
Actually, the validation platform starts 1 year ago, in May 2009. In fact, we have already accomplished 2 phases. Phase 1, we are going to test and sharing 2 items. Firstly, the patient's identification and demographics, and secondly, the patient's discharge summary or clinical summary. So that in the phase 1, 9 stakeholders have already contributed more than 2,000 electronic records and show that they are really exchangeable and they can really be represented in the same format. So we are very happy we move into phase 2, and phase 2 will add 3 more items: drugs, diagnosis, and allergies, which are the very important item in the medical record. So far we can share 5 items, and together in the phase 2 we are almost in the completion stage. And so far we have more than 8 stakeholders handing in their sample records and show that it really works. So actually we are now in the completion stage. We are going to write a summary and a lot of recommendations to the government so just express our views on the feasibility, usefulness, and our possible challenges or obstacles that can be used as a very good reference to them.
EHR project actually it's a holistic view of the whole patient's health information, not just clinical but whole health information. I can see that the validation platform is a forerunner. As Dr. Wang has just mentioned, actually we discuss about the standards. We have tried out the patient demographics in phase 1, and then in phase 2 we try out even the allergies and the discharge information, which I call it is the way step forward in conforming, and we try to agree with a common standards so the information can be exchanged and understood. This is a very important thing, may I repeat again, is exchange, meaning the different stakeholders may know what's the data content inside and what does that mean, so that they will have 100% correct idea what type of data or information they are referring to, and then so that it can be understood for further clinical judgment and also clinical assessment.